Good morning. Dr. Gary here. We are dentalpracticeguide.com is our email. We are dental brokers nationwide. And we've been doing this for 12 years. Anyway, so today's topic is selling doctor cannot let go due to fear of inadequate future income. We're going to get into this subject. I've talked something about this before. This is another case study. So I'd like to call it case study of a doctor that can't let go because of financial obligations and can't sell. Right now, it's 12 years we've been doing the dental practice brokerage. We're in 27 states right now. We have the 10 employees, and we hope to be going to quite a few more states in the very near future. We just hired a few more people, and it's very promising. We're excited about it. As you know, you can reach us that'll be 7:30 a.m. till 9:30 p.m. East Coast time. We answer the phone every day except Christmas and Easter. Our phone number is 201-663-0935. Our website is dentalpracticeguide.com. And anytime you have questions or issues, just call us. We'll talk to you about it. Buyer or seller, first-time buyer, first-time seller, just give us a ring. And I'll be happy to give you some chat. If you want your practice evaluated, we can give you an evaluation at no charge. Just give us a ring, and we'll be happy to help you. The information you're about to hear is for entertainment purposes only. It is not legal or business advice. So just please remember that. Once again, our phone number is 201-663-0935. Website, Dental Practice Guide, G-U-I-D-E, dentalguide.com. So we have a situation, a doctor's 66 years old. And him and his accountant are coming up with this formula and dollar amount they need out of the practice before they could sell. Doctor's going to stay on, so we'll have a source of income. The seller will stay on. And he's coming up with these formulas, and I'm like, once again, what you need out of a practice, the selling price has nothing to do with the value of the practice. Just because you need that out of there, because he's coming up with these calculations that him as an accountant have determined, he must get this dollar amount. Well, there's no guarantees in life, and as you know, this has been a difficult month for disabilities with doctors calling me. We have one doctor passed away at 59, another one just got end-stage terminal cancer and virtually no symptoms, rushing around for that. Another one has developed severe breathing problems. You can't time this stuff. And the seller doctor in this situation will be gainfully employed. And also the seller doctor has an exit strategy second profession, but it doesn't have it down pat yet. It's not guaranteed what the exit strategy for the second business he or she is going to start. I try to talk to them, and at this point, they're so nervous they'll never go to closing, wasting everybody's time. I think what you've got to do in situations like that is, first of all, you're getting a significant amount of money up front. If it's not a DSO, you're getting all your money up front. You're talking about a lot of money. And this practice is over $1 million. So you're getting all this money, this time value of money. We're going into a recession or some very difficult economic time. I do listen to Peter Schiff. I believe in him. He's on YouTube. And there's dark days ahead, unfortunately. Financially, I'm sure we'll get out of it one way or the other, but it seems to be happening. Recession / mini depression. Something's going to happen. So what you've got to do is, if you're in a situation like this, you've got to get more money out of the practice than the value of the practice is worth. Simply set up well ahead of time your exit strategy, second source of income. I mean, begin working on it now. You could do it years ahead of time. Don't just, wait till like a year before. I mean, this should be a long-term formula. Begin setting up that exit strategy, second source of income, low overhead where you not necessarily have to be there every day, something where you have a minimal number of employees. Hopefully you don't need an office, something you can do remotely. There's so many opportunities. When you're an intelligent business person, as most dentists are, there are opportunities out there. Begin pursuing those other alternate source of income opportunities now. Just do it now. I mean, do it within 5 years, so to speak, when you're going to retire. But I'm dealing with so many disabilities. This is why I'm making this tape. In the last month, it has been challenging. With somebody passed away, another one an end stage cancer, and another is and the families, to see what the families go through to try to unravel this. It's just too difficult. I've always said, if you're somewhat close to retirement and you have somewhat close to having enough money to retire, speak to your financial advisors. And before they give you these formulas, say, well, wait a minute, now what if I pass away? I have all these formulas that I'm going to base, I can keep making money based on all the years, but my practice is going to plummet in value, if I pass away. You're talking 20 cents on the dollar maybe, if we have to deal with somebody that passed on. So this is something you got to talk to your advisors about and tell them. They have everything figured out. I'm just working extra and making all this money. And don't sell. They'll tell you, work 2 years, you'll make the same money. What if you don't make it to 2 years? You don't know what's going to happen. And dentistry's hard. I got out when I was younger. I think I was 49. My hands did bother me, so I got out. But I just think this is something you've got to take into consideration. If you don't have enough money to retire, then set up the second source of income now, well ahead of time, and you really like it. I enjoyed dentistry. I had a great time at it, but I'm having more fun now, more flexibility now. I have much less overhead. It's hard. You got to put a lot of hours in, but my overhead is much, much less, and I have much more freedom. So I enjoy what I'm doing. You could do different professions, the same thing. Start thinking about that now is my message to you. Remember, if you're selling to a DSO, please give us a call because they'll pay our commission. And often they will, sometimes we can get your legal fees reimbursed. So check it out. All right, thanks team, bye now.